So glad you could join me today, everybody. And I still can't believe the unofficial end of summer is upon us with Labor Day weekend. At least there's college football to look forward to. It's also a time of year when our kids face new pressures as they're heading back to class. They're facing peer pressure, all things that can lead to bigger problems like drugs and alcohol abuse. Our expert is here with advice for parents as they help their children navigate these adolescent challenges. Also today, a Central Ohio hospital is receiving top honors for being wired, how this technology is providing better patient care. And it's your last chance to register for this week's daytime giveaway. Details are ahead on the show, but first this afternoon, schools are in full swing and your kids are already juggling assignments, homework, sports, or activities. When you add the social pressures into the mix, it can be a tough time for teens. Parents need to know that this is the time when kids can be exposed to drugs and alcohol. Ed O'Reilly of the Neil Kennedy Recovery Clinic in Dublin is back with us today with advice to parents. Ed, nice to see you.
Good morning, Gail.
And sadly, this is one of those things that all parents have to think about as their kids are adolescents. And at the Neil Kennedy Center in Dublin, you get an idea of how many kids are out there abusing drugs and alcohol. What are you seeing?
Well, in terms of numbers, we saw about 100 in the last, 2012. And there, there is a fair amount even in the more affluent parts of town. And
which surprises people, but it shouldn't.
It surprises people, but it shouldn't. Yes, that's well said. There's no escaping it, really. Now it is true that it sometimes takes different forms depending upon the neighborhood, but it's pretty much everywhere.
How early are you seeing some of the problems start? Not just for the kids that you see at your center, but in general.
Usually, one thing about adolescents is they do develop a problem faster, but by the time we see them, they're usually 14, 15, okay? Sometimes there is some experimentation at an earlier age, but not very common, at least not in the kids we've been seeing.
One of the interesting things that you told me was that parental influence is showing to really have a positive influence on kids, much to what we as parents think it's fallen on deaf ears, our advice. Explain this phenomenon.
Well, it's interesting. This is one of these cases in which, it's really it's a good idea to do some science, okay? Because what all the studies show is if you talk to kids actually about what the main influence is on whether they drink or do drugs, what we find out is the most significant influence is the parents, the position of the parents in the family on alcohol and drugs. Now, this sort of flies in the face of what I think many parents would say, which is
they're not listening.
Yeah, they don't pay any attention to me, but they do. Now I will admit that they will sometimes tell you they don't. Okay, sometimes to your face, actually. But what you find out is that is not the case. They actually do. I believe it must be in the job description for teenagers that they have to tell their parents they don't pay attention to them, and when in fact it turns out that they do.
Yeah, that is good news, actually, and know that parents, if you're doing it, keep on doing it because it is not falling on deaf ears, as they say.
Right.
So at the Neil Center in Dublin, Neil Kennedy Center, you see many kids with addictive substances that maybe we as parents don't know about. What are you seeing that's out there that you want to make sure parents know about?
Well, I will say most of what we see is what you might call the tried and true.
Okay,
the
they've been around for a while.
Parents do know about, like alcohol, marijuana. We do see, unfortunately, an increasing amount of the opiate-based painkillers, and even a little bit of heroin, which is what is extremely scary to many parents.
It is.
But it's increasingly out there in the upper middle class in the suburbs. So there's a wide variety. What most people think of as the more exotic things like spice, bath salts, some drug that has a new name for an old drug, it's Molly, which is basically usually ecstasy, which is known as a club drug, is out there and popular. Kids will use that somewhat, but they do actually tend to stay on the tried and true, shall we say.
What should parents look for, and when should they seek help for a child?
Well, I would say that the most important thing to start with is to have the conversation with your kids about what your position is as parents and as a family. Okay, we expect that you will not be doing any underage drinking and you won't use any illicit drugs, for example. And it's important to be clear Okay? Because what a lot of parents will do is they will say, well, my kids have been exhibiting fairly good judgment. Okay, I think they got a decent head on their shoulders, and I think they'll be okay. Well, they might. And what helps a lot is this clear description. Okay, over and above that, it does admittedly become difficult because many of the characteristics of someone who's getting into drugs also mimics things like a little bit of depression, a little bit of adjustment to a new school,
But parents
fights
see
with
these
boyfriends.
things. Yeah, they know them as signs. So whatever it is, they should take that cue that there's something going on with
Absolutely.
their child.
That's a good point, Gail.
And I know that one of those things could be drug abuse. We've had your information up there, but I know you want folks to go to your website, Ed, where they can find more information to see if they should check with someone like you.
Yes. I would say that's a very good point that you know your children, okay? If they're exhibiting behavior or emotions that are at variance with what you normally expect, there is a reason.
Okay.
It might not always be drugs and alcohol, but it's a good time for a conversation.
Ed, thank you. A good conversation to be had by us, too, so I appreciate it.
Right.